It is just a huge honor for me today to be podcast interviewing Kent Tuttle right here in my home. Thank you so much. He practices up the street from me. I'm in, are you in Phoenix too?
Yeah.
Technically, we're both in Phoenix.
West Phoenix.
He's in West Phoenix. I'm in South Phoenix. Ken Tuttle is in his third year out of dental school from Midwestern University in Glendale, Arizona. He works for Risas Dental and Braces in downtown Phoenix by GCU, which is Grand Canyon University. That's a Christian school, right?
It is, yeah.
A Christian school.
Mm-hmm.
A group practice privately owned in Colorado and Arizona. Kent is the son of Dr. Gregory Tuttle, who we've had on the show, the founder of TuttleNumbNow, the revolutionary intraosseous single-tooth anesthesia technique. Dr. Tuttle served a 2-year LDS mission to Ecuador, which means equator in Spanish, right?
That's right.
Where he learned Spanish and went on to major in Latin American studies at BYU in Provo, Utah, where the god of dentistry lives, Gordon Christian, right?
Claro que sí.
And what's that?
Claro que sí. Spanish.
Kent went on to play D1 college volleyball for BYU and semi-professional basketball. He's 6'5". Before becoming a dentist, while in school in Arizona, he met the love of his life, Jessica, and they were married the same week he graduated. Kent and Jessica now have 2 young children. Kent is passionate about serving the underserved and loves that he can use his Spanish every day and bring dentistry to those who otherwise could not afford it. Kent is passionate about all things dental related. When he is not at the office, you can find him playing golf or swimming laps. Well, I know why you like to swim.
Why's that?
Well, I read a whole deal on it, a short, fat guy like me is like a barge. But if you're pushing all that water 8 pounds down.
Right.
But if you look at all the submarine designs and you have a shape. And I read this deal that if you're ever going to get an Olympic medal in swimming, you got to have your height. Like how tall is Phelps?
So, I think he's up there, 6'4", probably.
Can you
6'5"?
Google how tall is Phelps?
Yeah,
the Olympic
he's
medalist?
up there. He's got the torso, though. They say that's good. He's got shorter legs and a long torso. I got kind of longer, heavier legs, so I sink a little bit.
Well, see, 6'4", and you're 6'5".
Yeah.
It's in swimming fast is all about reducing your resistance.
That's right.
And if you look at those guys, like when they're doing their stroke, half their body is out of water half the time. I mean, they're just. Oh
yeah, it's phenomenal.
It's funny because when I did 3 Ironmans, I did Arizona Ironman 3 years in a row, and the bike you just gotta learn how to pedal, not get hit by a car.
Right.
The run you just have to pretend there's 4 lions behind you and you're gonna die if you don't keep moving. But the swim was so technical, and it was Mike DeToll who told me, dude, don't learn how to swim without a coach. You don't learn how to play golf or swim without a coach.
Okay.
Because he said you can't afford a bad habit.
I need to get a coach then.
Oh my God!
I don't know what I'm doing.
I got this girl Angie, and swimming is like it's more technical than gymnastics.
Well, you know why I started swimming? All the wear and tear on my joints from playing college volleyball and then semi-professional basketball. My joints are so bad, even at 32, where it's just I just resorted to swimming. I did CrossFit for a little while, and my joints just took a pounding. So swimming is, it's a great exercise.
Well, your eyes still work because hold up your iPhone.
Yeah, I got this.
Yeah, you're a grandpa when you have the 6X iPhone and you have to wear Ritos.
This is outdated. This is the SE, but I love it because of how small it is. It fits right in my pocket. That's like an iPad.
Yeah, and it's funny. Yesterday, you know what I did? I was so dumb. Yesterday, I posted an article, and it was from 2010. Okay. Because on this big screen in my readers, I thought it was 2018.
Yeah.
And then the first comment is like, dude, that was from 2010. I'm like, I want to say, hey, screw you. I'm 55 with readers on and the biggest damn iPhone I can buy.
You seen those guys that go counterculture? I heard an article of Karl Malone, the NBA player for the Jazz. He went back to a BlackBerry. Like just to have a little flip phone, BlackBerry. I don't know why some guys do that, but.
And Eddie Murphy has never had a cell phone.
Really?
He said he's never had the internet, the social media, the phone.
They're addictive little devices.
That's what he said. He was on TV. He said, you know what? He says, I see all these people.
Right before I go to bed or right in the morning. Drug. Yeah, it's
so tell us on your journal. So when you graduated from dental school, did you have any student loans?
Midwestern. I went to Midwestern private school here in Arizona in Glendale, and it was pricey. Great education, loved the school, loved my instructors, great experience, but yeah, it was pricey. So I took the maximum out, even though I was single. I probably went on a little too many vacations during school, you know what I mean, to just stress. And but yeah, up over 500 grand in debt.
So I love this stat because the cost of raising a child in the United States from birth to 17 is $233,000. So you basically graduated. You already bought 2 kids in dental school,
right?
And now you had 2 more. So now you're
I'm
really
up over $1 million.
You're in my category. I had 4 kids. So wow. you have 4 kids. Just 2 of them are named student loan
A and B.
Yeah, and student loan point B. So now did you said you met your wife in dental school?
So yeah, I was in dental school. I was living over in Glendale, but I moved a little bit further east in the Scottsdale area because I felt like there were more girls out there.
Yeah.
Where I was at, it was like 5 to 1 guy to girl, because you got all the Midwestern students. So I moved out east, and yeah, there she was. She was just sitting there in church, and yeah, the rest is history. We were friends for a while, and then yeah, it was crazy. We moved. I turned 30, graduated dental school, got married, and moved all in 1 week.
Damn.
Yeah, it was crazy.
Is she a dentist too, or?
No, she's not a dentist. She graduated from ASU. She's got her bachelor's, but she's just stay-at-home mom right now.
Stay-at-home mom right now?
Yeah.
And how many kids you guys want?
I'm the oldest of 5 kids.
Yeah.
So probably 3 to 4 to maybe 5. We'll see.
I grew up with 5 sisters and a brother.
Okay.
So
I like
that's
big
7.
families. Big families are fun,
so for me,
right?
4. I have a very small family.
Okay.
And it's all
Yeah,
it's all
4 is
relative.
small.
4 is very small.
That's funny.
And and I always assumed I would have had 6 or 8.
Oh my gosh.
But so where are you at on your journey now? So you decided to work for a DSO.
Yeah.
I mean, would you call Risas Dental a dental services organization? I mean, they have
kind of like a group,
20, 30 locations.
Yeah, it's like it's privately owned, but I'd call it more of a group practice setting versus corporate. I got a couple partners, and but they are expanding rapidly. I mean, it's growing big time. So yeah, but I'm in there. My main thing out of school was my dad's a dentist. He gave me the advice to keep your handpiece humming. And I kind of like that phrase, just keep your handpiece humming. In school, I probably did, 5 endos? And they limited the molar endos. Those were all done by a specialist with a microscope. Right. And, so I get out of school, I know how to do fillings.
And how many?
But endos, and extractions.
And how many board-certified endodontists work at Midwestern full-time?
That's a good question. I do not know the answer.
I mean, can you name
I would
any?
say just there's one. I know it's Dr. John's.
That's what me and Brad Gettleman were talking about because we both graduated from UMKC in '87. There were 6 full-times.
Really?
When we were there, but a lot of these private schools, it's like the tuition is twice as much, and they have like 1 guy.
Yeah, I know.
And you're like, how does 1 guy teach?
Right.
What was your graduating class? What is it, 100 a year?
Into the 200 range. Midwestern had a bigger class size.
So you guys,
about 200.
You were 200 in your graduating class?
Yeah, it was a little over 200.
So one endodontist can't teach 200 people endo.
I know. I mean,
it can't happen.
Right.
So, but that's the best thing to do is get out of school. Work in a high volume dental office.
Exactly, high volume. I don't know what the average dentist sees. Maybe like 10, 15 patients a day. I don't know. I see up over 30. I do all my own cleanings, and so I'm busy. Very busy.
So do they not have hygienists there?
No hygienists. Just I do my own cleanings. I do lots and lots of endo. I think since I've been there, this stat was kind of crazy when I looked at it. Just 2 years, I've done over 350 root canal procedures. So I think that's kind of a lot.
So it's an interesting concept. So explain why you think there are no dentists there, or no hygienists there.
It's keeping everything. I guess when you have a hygienist, then you pay for a hygienist, and I guess we are pretty efficient at what we do with the SRPs, and I think we just take care of people right then and there.
Well, I'll take it a step further.
Go for it.
People, this is Dentistry Uncensored, so we only talk about what everybody doesn't agree on. I don't want to talk about anything anybody agrees on, but the bottom line is there's only 3 publicly traded dental offices on Earth.
Right.
And 2 are Australia, 1 300 dentists, Pacific Smiles, and 1 in Singapore, Q&M, and none of them have hygienists. Due to insurance, I can't pay a hygienist $40 an hour to do a $55 cleaning in a dental office with $65 overhead. It's simple math.
Right.
So whenever you look, you guys are expanding rapidly, correct? You have no hygienists.
No hygienists.
So look at that versus all the other DSOs, none of which can go public. Imagine going on Shark Tank and telling the smartest one is Mr. Wonderful, this is bald.
Yeah.
And you probably like Cuban because he's a basketball player.
There's a wisdom in that.
You're trying to get a job from Mark Cuban.
Right.
What would you do if Mark Cuban called you up and offered you a job? Would you leave your dental office and run to the Mavericks, or would you?
In a heartbeat. Probably would. Yeah.
So they imagine going to Mark Cuban and saying, well, Mark says, "What do you want to do?" So, well, I want $1 million, and I'm going to buy $1 million dental office.
Right.
That's all these DSOs are. They're roll-ups.
Okay. Yeah.
So then you come back and say, "Man, we went from 0 to $1 million." But Wall Street's saying, "But yeah, on your balance sheet, you got $1 million in debt." So now what do you want to do? Oh, I want to get 10 more million.
Yeah.
Buy 10 more offices so I can come back.
Keeps expanding. Yeah.
Yeah. So their debt sheet is going. They're buying cells. It's just a roll-up. There's nothing unique about it.
Totally
Whereas the 3 publicly traded dental offices, they went and got $1 million.
Okay.
And then every year they're paying their debt down while their cells are going up and up and up and up and up. And they all have a few things in common. Number one, none of them have hygienists.
That's very interesting.
Because they say, you know, if I was going to have a hygienist, I need the insurance to give me twice as much money for a cleaning exam.
Yeah.
They're not going to budge.
Right.
So they're with the hygienist.
Right.
And so in your dental offices, the dentists do their own cleanings.
Yeah, I mean,
and sorry to beat this dead horse again, but guys, I'm telling you that you're still stuck in this Happy Days 70 Brady Bunch model where you sent Delta Dental your fees and they just paid 100% of your cleaning exams, actually whatever fees you submitted.
Yeah.
And that's gone. They're paying PPO. So what's happened? You go to a place like Singapore, you know, back in the 70s, they all had 4 or 5 ops. They had a dentist checking 2 hygiene, just doing the American thing.
Yeah.
As the fees come down, you go back to Singapore and there's no hygienist. I mean, there's not 10 hygienists in the country. I don't know. Do you call it a country? It's a city country.
So, yeah.
It's a country.
City
it's
country,
an island.
Singapore.
Yeah, but there's no hygienist there. And if you look at the dental offices in America today that have 50% overhead, the one thing they all have in common is no hygienist.
Really?
Wow.
What about assisted hygiene? I feel like that's technically what we're doing, is we're doing assisted hygiene, so we're able to do quickly, you know, the cleaning.
But with the assisted hygienist, here's the deal. So when you look at a hygienist getting $40 an hour to do a $55 cleaning, you know, so much of the time spent is not hygienist. I'm sitting in the room, going to get the patient, seating the patient, taking x-rays. Well, the dental assistant can do all that. And then when you do the scaling, you need someone to record the numbers.
Right. Yeah,
and then the dentist has to come in and do an exam. So you have assisted hygiene. I still need a 5 or 7 minute block for the dentist to come in and do the exam. But when you just come in and do the perioprobing and then the scaling, and that's your exam, you're bonding with the patient. How's the wife? How's the kid? How's the cars? And then when you leave, then the assistant comes back and does the polishing, the floss, the fluoride treatment, checks out the patient, cleans up the room. And so with assisted hygiene, I still got to have a hygienist in there and a dentist exam check. And then who gets the fee? The dentist would get 25%. What percent do they pay you?
So it varies month to month based on collections. So,
but is it just a straight percent of collection?
No.
Okay,
no, it varies month to month. It's more complicated, and I can't really talk about it.
And then that's really cool. We don't want to get you in trouble with
of course.
Your management team. But
they're good to us though.
Good. And but they don't have hygiene, and so they're massively profitable, as pointed out by they're massively expanding.
Yeah.
So then you go to these dental offices, you say labor should be 25%, and you see 25 to 35% all day long.
Yeah.
And they say, well, it's 25% of production. It's like, dude, you don't get paid on production. You get paid on adjusted production. And you tell everyone, if I call a dental office in Phoenix, how much you charge for a crown? $1,000.
Okay.
And I say, buddy, 90% of all the crowns you did were with Delta and all these PPOs. 90% of the crowns you did were for 700.
Right.
You tell everybody on the phone it's $1,000, and then they hang out and call someone else.
Yeah.
Why do you tell everybody your prices that you never get? I mean, you get, a lot of
you get whatever the contracted fee is.
Yeah, and a lot of dentists say they're not. Ryan, Google Delta Dental. What percent of American dentists participate in Delta Dental? I mean, I think last time I saw on their website, it's like 95%.
Is it really? Wow.
So 95% are all getting.
They're all in there.
The fee set.
Yeah.
You know, when I graduated 30 years ago, I got $1,000 for a crown and $1,000 for a molar root canal.
Okay. Yeah.
Now, 30 years later, that's
just a
like
little bit
700, and 700. So the fees have come
gone
down nationally 42%.
Interesting.
So the hygienists are the first casualty of war, and they're still opening up hygiene schools, and you go to the hygiene schools. What's the problem? What do you think hygiene schools? Well, it's hard to find jobs.
Yeah.
It's like, okay,
definitely.
so we've been in an economic expansion for 6 or 7 years, and they're having a hard time finding jobs. What do you think it's going to be like in economic contraction?
I can't find the exact percent you want, but it says approximately 30% of Americans with Delta dental benefits are covered by the member companies of the Delta Dental Clients Association.
So 30% of Americans have Delta?
Yeah, it doesn't say what percent of dentists accept it, but it says 30% of Americans have it.
30% of Americans.
So a little lower.
I wonder if it's 30% of Americans or 30% of Americans employed. There's 325 million people, about 150 million have a job.
Oh, it said 30% of Americans with dental benefits.
Oh, okay, 30% with benefits. That makes
I'll
sense.
try to find what.
No, it's okay. I think it's about 95%. But so you've been with Risas for 3 years.
Yeah, coming up on 3 years. In November, it'll be 3 years.
So, what is your plan? I mean, do you think you'll stay with these guys for a long time? Is your plan to start your own?
My plan is to ride this wave, as far as it takes me, pay off debt, and then, we'll see at that point. Someday, I do have those dreams of being, my own private practitioner, having my own practice. But with with the astronomical student debt and with the situation we get put in when we graduate dental school, to go into debt for a practice right now doesn't make a ton of sense. But you never know. You never know. I'm just kind of taking it one day at a time right now.
Yeah. Well, I mean, one day at a time. 3 years is a long time.
Yeah, it's a long time.
Are you familiar with any other corporate dental office chains in our backyard of Phoenix that do not have hygienists either?
In the backyard of Phoenix?
In our backyard.
I do not know.
Is Risas the largest corporate dental
in Arizona?
In Arizona?
I don't think so. There's Bright Now. There's what are some of the other ones? There's Comfort Dental. That's more Colorado.
Right.
There's a few. I'm not sure the names off the top of my head. But
so none of their offices have hygienists?
Pacific Dental Services.
No, I'm talking about just local, not national ones.
Oh yeah, no, I don't know about the hygienist specific. I haven't researched.
But how many of their locations have you worked in?
The Risas Dental locations, just in this one. I started the office from the ground up. So the building was, we built the building. We had 0 patients, and then I started the office. So
interesting.
Yeah.
I hate saying that message because it really crushes hygienists' hearts when I say that, and they say, "How can you say that?" It's kind of
daunting, right?
Well, here's what I say to it. I say that it's your patients aren't willing to pay you a fee out of their cash.
Right.
I mean, if you drop the dental insurance subsidies and the hygienist says, "Well, I'm just going to do clean exams, X-rays at your dental office, and I'm going to charge $250, and we'll be profitable."
Right.
Well, your patient's not going to pay it.
No.
So how many dentists do I know that said, I hate this insurance thing. They dropped all their insurance. Usually some cosmetic guru tells them how to do this who doesn't have a dental office, and you're paying, $4,000 a weekend to go hear this blowhard. So then you go back, you drop all your dental insurance, and guess what happens?
Yeah.
Now they go south.
Yeah.
And some of these kids, I remember talking to one dentist that was in a small mining town.
Okay.
Once all the students' parents were saying, "Oh yeah, he's too good for us. He doesn't take the miners' insurance." His kids started getting beat up at school.
No way. That's
so
pretty brutal.
He had to send a letter
it's a dog-eat-dog world, right?
Well, if you're, everybody needs a dentist.
Yeah,
and if you're in a mining town at 5,000, Utah, Nevada, they got lots of towns where
they do, yeah.
So you're the local dentist there, and you're sitting with them at church on Sunday, but you won't take their miners' insurance. That's the way to get the shit beat out of you.
Wow, yeah, for sure.
So if these dental offices drop all the insurances. Well, the patient isn't going to pay for the overhead structure. That was what I thought was so funny when hygienists said, "Well, we want independent practice," and all the dentists "No, you can't let them do that." It's like, no, let them go.
Yeah,
let them go, because by the time they get the rent, mortgage, equipment bill, that computer, by the time they get in there, they're going to realize that they would
Doesn't make sense.
that they would go bankrupt.
Doesn't make dollars. It doesn't make sense.
Yeah. So, so you've been there 3 years. That's a long time.
It's a long time, and I've gotten plenty of experience.
You're a millennial, right?
Yeah, I guess so. Barely. But
so millennials, it's not just in dentistry, but when you go the greatest companies to work for, the highest multiples of 29 times earnings on their price earnings, Facebook, Amazon, Apple, Netflix, Microsoft, Google.
Right.
The average millennial only works 1 to 2 years.
Really?
So when you go into all the large national DSOs, that's their. I say, well, what's your number one problem? They go employee dentist turnover,
retention. Yeah.
These big companies that have several hundred dental offices, they got vacant dental offices in small towns all around America where they're looking for a dentist. I mean, they have full-time recruiters. And by the way, when I ask every one of them, where's the best way to recruit dentist associates or sell a dental office? They all say, Howard, it's on your free classified ads on Dentaltown.
Wow, really?
Yeah, we have 6,500 ads.
Wow.
They're all free.
Right.
And over 1,000 unique dentists a day visit the classified. So if you're looking for an associate, and plus we made it so if you're looking for a job, you can upload your resume and picture. We stole every idea that all the major job boards have, like Monster Job and all that stuff.
Right.
And it's a great place to buy and sell a practice. And a lot of brokers that are selling offices, like say in Arizona, they advertise all the people in Arizona.
Yeah.
Well, the guy that might be buying the practice in Arizona, maybe he's in the Navy, and right now he's in Hawaii or Florida, or he just got married, and he's in Michigan, but his wife says, I want to live in Phoenix.
Arizona,
So the international of the internet, so the classifieds are flipping amazing. But so you've been there 3 years. I mean, that's
it's
a
significant
long
amount of time. Yeah.
For a dentist associate, that's a really long time.
Yeah, I would say so. I mean, I think the difference though with Risas is they treat us really, really well. The culture is second to none, I think, as far as those DSOs and stuff like that go. They take really, really good care of us. So the retention of these average places is pretty high, or pretty bad, and lots of dentists leaving. Risas is very, very good.
So is it common to have
people are
stay?
staying. I mean, I can count probably on two hands like how many people have left. And that's
So who do you give credit for that? The CEO is Jeff Adams.
Yeah.
The mafia always said the fish rots from the head down. Okay. So it's the top dog that creates the culture of a company.
Yeah. The CEO Jeff Adams, he's a phenomenal guy. You just got to get to know him. He's
well, tell him if he doesn't want to come on the show and give away trade secrets. Tell him I still want to have lunch with him.
Okay, sounds good. I'll pass along the message.
Yeah, tell him I'd love to. I love talking dentistry, especially if you're eating a big old greasy cheeseburger.
I went golfing with him just the other day. Went to Paradise Valley Country Club, and it was the first time walking with a caddy. It's pretty cool. Cool. Golfing with a caddy. It was pretty cool. Yeah.
Ha! So is Tiger Woods your golf idol?
No. I think his life outside of golf kind of,
So the $500,000 student loans, and now you're getting married. Now you're gonna have a couple kids.
Yeah.
Did you refinance that? Do you have
not yet?
goal?
I'm headed towards that to refinance. That's kind of the next step.
And what are your thoughts about that?
I think it's a good idea. Get a lower interest rate. I mean, part of it, getting away from the government, right? Because then you go to privately owned, and then I don't know if there's ever loan forgiveness. That kind of worries me to then be with a private company instead of having the government loans that could possibly be forgiven. But I think with our incomes, we're never going to be forgiven of the debt. So that's why I'm okay with refinancing and then just going into the lower interest rate.
The brutal reality is that the rich get richer and the poor get poorer. So every time the government of any country is going to do anything, it's going to benefit the very richest people.
Yeah.
So if they could give billionaires and millions, like I just got this huge tax cut.
Right. Okay.
Well, don't you think that should have been a student loan forgiveness program?
Right.
Or people losing their home?
I feel like it would pump a lot of money into the economy if they forgive.
But it's the way tribals. All people are in tribes.
Yeah.
And all tribes have their leaders, and all the leaders grease each other.
Yeah.
And no one has ever cared about the poor man since the beginning.
What's interesting too is so my dad's a dentist, and I know there's some dads who probably help their kids out with the student loan debt. I've heard of that. Oh yeah, my dad's paying for. They got family money. Oh, my dad's paying for my loans. My dad told me he's like, no, I want you to feel every dollar of that student loan, that weight on your back, so that you are motivated to be successful, so that you work hard at your craft, so that you're sweating every day, to do, because you guys all had student loans coming out.
My dad told me the same thing.
Maybe the number wasn't as high,
he
but
paid for my sisters to go to college because they were girls.
Yeah.
But I was a boy. So he said, "Howie, if I pay for your college, you're going to go up there and drink beer and chase women." And,
Right.
No way.
No, you gotta
Because
pay
you're going to
your
be a
way.
self-made man.
Right.
It's all on you. I mean, he
Which
didn't
I appreciate.
give me a dime.
I appreciate. That's good.
And it was really a weird feeling to be up at Creighton University, having to take out student loans and buy pot with it. You just felt, you just didn't feel right taking.
Yeah, it doesn't
money.
feel right.
It'd be a cold day in hell before the government paid off all the student loans.
It's not going to happen.
It's not going to happen.
Right. So I'm going to
Because if they
refinance.
had a choice between paying off $1 trillion of student loans,
Right.
or $1 trillion of the people's credit cards,
Yeah.
or $1 trillion of tax cuts for the Fortune 500. Guess who?
It's going to be the latter.
Yeah, because the only way you get a bill passed in America is with a wad of bills.
Mm-hmm.
And it's just amazing how when you talk to those
Corporate America, right? You got those few companies.
They
that
always talk
control
about all
everything.
these other countries where they take bribes. In America, it's the same thing.
Yeah.
But you ask the congressman, well, doesn't that money affect you? No, he's just buying into what I believe. I respect the fact that he's buying into my campaign with a $100,000 donation because he believes in my vision.
Yeah.
It's like,
No, same level of corruption.
It's corruption. It's like
Exactly.
I give you 100,000. I thought the biggest deal was amazing is when Walmart was, they were selling these prescription pills for $10 a pill in the United States,
Yeah.
but selling them for 50 cents a pill in Asia.
Yeah.
So Walmart said, no problem. We'll start buying them in Hong Kong and shipping them back to America.
Yeah.
And they raised, the pharmaceuticals raised just $6 million for George W. Bush's campaign. And the first thing he did is ban that practice.
Really?
So it's like, so all these poor grandmas
They can't do
elected you
anything.
go to help them.
Right.
And at the end of the day, the Chinese lady gets it for 50 cents and I pay $10 because I live in America and I voted
Just
for
a
you
rip-off. It's a
to help
complete
me.
rip-off.
I mean, yeah. And that's why a lot of people always say to me, they go, oh, God, you spend so much time on Dental Town and dentistry and Dental Town. I feel good when I'm working in dentistry. When
Yeah.
I watch the news,
Ugh,
I get
depressing.
nauseous.
No, depressing.
It's like I don't want to hear about it because they're just gross.
It's funny you say that because with any free time I had, my kind of stress relief was either sports or it was going into the news and current events. Drudge Report, 960 The Patriot. I was on all these websites. Alex Jones, even the conspiracy theory guy. So I'm into all this, and I stopped completely recently, and I've switched only over to Dental Town. Because I got my CE credits coming up. I'm a little short, so I'm diving into now the craft, and I want to learn all I can. I'm passionate about dentistry because other stuff it gets even the sports is just mindless, distraction.
So who was the most
So-
favorite character on Sesame Street? There was a couple. One was Big Bird, and was it Oscar the Grouch was the same guy?
Oh,
Big
was
Bird
it
and
really?
Oscar the
My
Grouch
son loves
was the same guy.
Cookie Monster.
Well, Cookie Monster.
I mean, he is got to be it, right?
No, what's the new one? Not Cookie Monster. Elmo.
Elmo.
So one guy did Big Bird and
Yeah.
Oscar.
Yeah.
And then 100 guys did all the other characters.
Right.
And he really was
Big Bird
Sesame
and
Street.
Oscar. Interesting.
And he was retired because a new puppet, Elmo.
Okay.
The kids dumped Big
Took
Bird.
over.
But when they talked to him about Oscar the Grouch, you know why all the kids love Oscar the Grouch?
Why?
This is what's sad.
What?
Who do they think Oscar is?
I have no idea.
Their grandpa.
Are you serious?
Sitting in the chair, watching the news.
Yeah, cynical, angry at the world.
And remember when we were little, the Peanuts cartoon, whenever the adult would talk,
Yeah,
it was always wah, 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 wah. You didn't even know what they're saying,
Right.
talking over their head. And I have seen so many times when my grandchildren are in the room and their fathers are screaming at the news,
television
and I
or-
see the face on these little kids, and I just pick up the room and I say, guys, you're scaring my granddaughter.
Yeah.
And then they're like, well, and it's like, I just think it's all toxic.
Yeah, just cut it out of your
Yeah,
life.
so you cut it
don't
all
need
out of your life.
Yeah, I'm cutting it. I'm scaling back, definitely. Where I used to grab my phone and go on the news, now I'm grabbing my phone going on Dental Town or going on, YouTube,
It's why
YouTube videos.
I stopped golf is because my golfing
Yeah.
friends,
They're assessed or what?
Well, I mean, they miss a putt and they're throwing clubs and they're yelling profanity, and I'm just like,
it's not a great culture either. The drinking, the cigars,
No, that's awesome.
So, okay.
Well, I'm just saying this: if you go do something and it reduces dope and it secretes dopamine, serotonin, oxytocin, I'm all in.
Yeah.
But if you say, "Hey, Howard, you want to go do something where I'm going to get really upset and cuss and yell and throw my clubs," I'm like, not really.
Probably not.
So my
that's
friends,
anger management, though.
Yeah,
Howard,
when my friends are in politics and golf, I don't even like them.
Yeah.
But when they're at the bar eating cheeseburgers, watching the Cardinals, they're my best buds.
Okay, I see what you mean.
So I want to be what Marilyn Monroe said. If you can't handle me at my worst, you don't deserve me at my best.
Yeah.
Well, I ain't married to my friends. I mean, if you're gonna go out and be miserable,
it's interesting what you're saying though, because I think there is a streak of that in new graduates. It's really easy to get down with the situation that we're placed in. Because I mean, you look at my dad, he graduated in 1990 from the University of Nebraska with 50 grand of student loans. That's it, 50 grand. Only, how many years later, 25 years later, I graduated in 2015, add a zero on the end, exponentially increased by a factor of 10. Are you kidding me? Like, that's not inflation right there. That's just, I feel like it's control. I feel like they want to control. They wanted to control medical professions, so they got control, and now they want to control dentists. And the way they're doing it is through our pocketbooks. I mean, it's hard to get ahead. It's hard to, I can't complain with the money coming in. It's great. We live a great life, but you have to be careful about your attitude and how you respond to the situation we're in, for sure.
I want to say
we chose it, right? We chose.
Yeah. Well, I want to say a couple things about that. So if you look at the history of time, there's always indentured servants where they give you a ride from Europe.
That's what I feel like sometimes.
To America,
indentured servant.
And then you had to work the farm for 7 years,
right.
And you might say that was a really bad deal. Well, it was a hell of a lot better deal than the African slaves.
Yeah.
That was a really human rights atrocity. But the thing I look at that is, okay, so you graduate $500,000 in debt, and the average dentist makes $75,000 here.
And that's higher than average, I think, right? The average is maybe $250 or so. I don't know what it is
in the public
nowadays,
schools, it's a lot higher. So I
Right.
just want to, I'm trying to get my calculator out since my brain no longer does math.
No problem.
Math problems in its head. So $500,000 divided by $175,000 a year on average job for general dentists is 2.857. So 3 years.
Okay.
So the question is, would you pay $3 to get a job that pays $1 a year when the average salary of the United States, so people who have a job and have a salary, the average salary is $60,000 a year. So 175 divided by 60,000 is 3 times greater. So would you pay $3 to get a job that pays $1 a year? And the average American who has a job and is on salary, that average is 60,000. In fact, I'll tell you the exact numbers. I just post that. And so in a time when artificial intelligence is destroying jobs, like for instance, Uber, 65% of taxis hails in New York City. Look what happened to Uber. So here's taxi drivers.
Yeah.
And then here's Uber.
Wow.
And then we look at salaries. The average salary, the highest is Luxembourg, 62,000. Number 2 is United States, 60,000. Netherlands, 52.
Just base average salary.
Yeah, if you're on salary in these countries, and by the time you're down to Mexico, it's 15,000. So a lot of dentists will throw a pity party.
Yeah, you don't.
I sit there, but what they're predicting now is like Tesla has the driverless semi cars.
Yeah, I saw the video yesterday, actually.
So why would you want to pay a truck driver who every 8 hours has to pull over and go to sleep,
right?
And he needs labor and medical and dental, and he can only drive 8 hours and go to sleep, where now I can buy a driverless car and I just set it off. Plus, when they wreck, it's human error. I mean, 40,000 Americans die in a car every year.
Wow, yeah.
So the truck driver, what's he trying to do? Go a little faster.
And all the liability that comes with that. Oh,
so the driverless car will go exactly 55.00000 miles an hour, 24 hours a day. So they're all going to lose their jobs. pilots, just look at pilot versus the cruise missiles. It's like the cruise missiles can fly 10 million miles without a single accident.
Right.
Well, talking monkeys can't do that.
Run away.
And right now they're already using cruise control technology for everything but takeoff and landing.
Right.
But the reality is that's when they screw everything up the most, takeoff and landing. So anybody that owns an airplane would love to fire all the pilots. The question is, when is America going to be ready to go get on Southwest Airlines and know it's being flown by Obi-Wan Kenobi and C-3PO?
Yeah, not quite
and
yet.
R2-D2.
Yeah.
And you still hear them. Phoenix is the test deal for Google's driverless car, Waymos.
Yeah.
Have you seen those around?
My brother, his commute every morning, he follows one of those cars. It's every single morning, same exact roads, same exact path, and they're testing them. Yeah.
Yeah, and then here's the human who doesn't trust that, and they're driving down the street like this on their cell phone.
Right.
So you're texting on Facebook, going down the road 45 miles an hour, and you're worried
That's
about
the thing. Our
driverless
addictions
car?
can kill us, like our phone addictions. If we're doing that, we can kill us. It's scary.
So talk about your update. The podcast before you was Stanley F. Malamed. And you have some news. So review your dad's TuttleNumbNow. Do you use it? Septodont.
Right.
It's in the news with Septodont. It's in the news with Malamed.
Let's start from the beginning. In school, they taught us not to bend a needle. And my dad was bending needles, getting into bone, intraosseous with his technique, TuttleNumbNow.com. So I'm caught in the middle here, right? Between traditional dentistry, the academia world, this is what you do. My dad's in the trenches every day. Hey, this is what I'm doing. This works. And so I didn't have the right needles. I had these short needles. And I said, heck, I'm just going to start trying. and I actually got into bone a couple times with the short needles, but it was really tough. But part of me was kind of skeptical of my dad. I'm his biggest critic. I'm just kind of like, you got lots of passion, but is this really legit? And so I get out of school and I'm like, all right, this is my time. I'm going to learn it. I had trouble in the beginning. And then it wasn't until I got with him, I watched him do a few, and then he sent me the videos, these instructional videos on how to do it, 20 steps to do it. And then there was a little learning curve, and then I got it. Well, the hardest part in the beginning was knowing if I was in bone or not. So then once I did the steps, once I practiced the technique, I was able to get in bone consistently, and I was like, wow, this actually works. And I was stoked about it because right out of school, I was able to get people instantly numb. I'm fast. I'm in this office with two other dentists that are my partners, and a guy right out of school. They have a little more experience, and our numbers are right about the same. So I kind of credit that to TuttleNumbNow and being able to set down the syringe, pick up the drill, start working. So the updates, there's a couple updates. One is that officially TuttleNumbNow has signed the contract with Septodont, a company from France who makes Septicane. They're going to manufacture a needle guide, a needle bending guide. It's right here. I got the update here from my dad today, but the 3D version is right there. I was sitting with my dad in his private office, and we came up with this together, me and him. Pretty cool. And now they're going to manufacture it, and he's getting a cut of the deal. Pretty good deal for him, but to safely bend the needle.
I can't believe your phone is this small. I would just have to.
You got to put on your loops, right?
I would just have to give up my phone if I had to look at that.
Yeah. So we got the needle bending guide that's now official. This is going to be on the market soon. And using those Evolution needles, those are the best. I've tried both needle types. I've tried just like standard needles, but the Evolution needle has the double beveled tip, and so it's sharper and it can get into bone easier. So it's great.
And what is what is the advantages? Why do you want to go through all this as opposed to doing this is only for mandibular
for
blocks?
eyes and stuff like that?
For just mandible?
No, I use it on the upper as well.
Why would you do that as opposed to just putting a carpel to the buccal of a maxillary tooth?
Great question. Even when I put a carpel to the buccal, the local does really well on the upper, but I don't like giving the palatal injections.
Right.
So I come in from the buccal with the NumbNow. I'm able to get into bone. It blanches the entire palate pretty much.
Yeah.
And so then I can.
So you think it's less painful shot?
Yeah, more comfortable because I'm not doing the palatal. Once I go into I might give a little extra on the palate, but after I've done NumbNow, and they feel nothing.
And
So
now they
it's
got
great.
that St. Renata's where it's a nasal spray.
Yeah, I've heard of that.
Have you tried that?
I haven't tried it yet. That's really interesting. Yeah,
Because there's a nasal spray now that'll numb the whole maxilla. I mean, just
Right.
boom. I mean, extract.
That's pretty cool.
Yeah.
I mean, those shots in the upper anterior are not fun.
Right.
I think my dad did talk about in the podcast with you is there is a way you can do TuttleNumbNow, not having to go infiltrate on the upper. You can just go in right in between 8 and 9 and get into that bone that way. Safely, effectively, going slow. And
But on the
they don't feel-
mandibular, I mean,
Yeah.
it's be a huge deal on the mandibular.
It's a game changer. It's a game changer. I see so many patients that sometimes I want my patients to wait. We have multiple ops. There's 9 operatories in my office, and I'm working by myself. I got all kinds of ops.
You're by yourself in 9 ops?
No. Normally, there's 2 doctors there. There's
Okay.
either orthodontist or there's me and another general doc. So I have the chairs where people can wait. So I'll just have them wait, wait.
Hi, Lexi. Hi, Emma.
But I can't even tell you how valuable it is when I want someone to be numb, to be able to go through the protocol and not have to guess and not have to worry. Sometimes if I give an IA, I come back, they still feel it. Well, I don't mess around with that. I'll just give TuttleNumbNow every single time, every single tooth, because of how numb they get. I tell people that come in, I'm like, I will get you super numb, and they love that. I'll get you super numb. And so that's what I do. And patients love it.
So what else do patients love? What are your hours in these in your dental
So I work
office?
12-hour days.
So the days. So
it's a long day.
What is your hours?
So
what is the office?
Yeah, we
hours?
see patients from 9 a.m. until 8 p.m.
9 a.m. to 8 p.m.
Yeah. So my wife's usually
How
calling
many
me.
days a week?
My wife's usually calling me right at 8 o'clock. Come home, I need you.
How many days?
So 3 days a week.
No. The whole office for the consumer.
Oh, the consumer, it's 6 days a week it's open. So it's open Monday through Saturday.
Monday through Saturday, 9 a.m. to 8 p.m.
9 a.m. to 8 p.m.
And so why not Sunday? Is that a religious deal? Chick-fil-A doesn't open on Sunday.
Right. It may be faith-based. Yeah, we just don't do work on Sundays.
But you don't know if it's faith-based?
I'm not sure if it's faith-based or not.
Because the one thing that always concerns me about dentistry is in Arizona, 8% of emergency room visits are odontogenic in origin.
Right.
And
Interesting. Hey, that's a high number.
If your child fell down and broke his leg on a Saturday or Sunday,
Right.
or on a Sunday or Christmas,
Yeah, what are you going to do?
fire department will show up,
Yeah.
take you to a hospital fully staffed, open 24 hours a day.
Yeah.
So if she broke her leg, she's good. But if she broke her tooth, she's
Yeah.
SOL. And
Isn't that why they passed recently the emergency access? Have you heard much about that?
I have not.
I see that.
Is that just for Arizona?
All day, every day. Arizona. So they're trying to get the patients out of the emergency rooms and into dental offices. So what they've done is they've given all the Arizona state plans $1,000. So over 50% of people are on this access, and they have $1,000 of emergency treatment to now use in the dental offices.
So you guys take
Great.
access?
Yeah, we take it all. So they come in, it's an dental emergency, we get $1,000, we can do a root canal, root canals.
Which
we
is
can
amazing
do
because the government
surgical
was
extraction.
averaging $1,500 to pay the emergency room.
Right.
And they got no care. They just got
Interesting.
Vicodin and
Yeah, no, they give them medication and say go see a dentist.
Yeah, they,
right?
they put them on PEMVK
That's right.
and Vicodin.
Yeah.
And
if
that
it's
costs them
severe, then they
$1,500.
might admit them and put them on an IV or whatever, right?
But if they gave you
yeah.
2/3 of that, 1,000,
Yeah.
you'd actually do some definitive treatment.
Exactly. So of our new patients that we see every day, I would say almost half of them all have emergency access. So it's a big thing.
So, a lot of people will work for, say, Heartland or Pacific
Yeah.
or whatever, and all they want to do is get out on their own. Then when they get on their own, I say, well,
Yeah.
what business did you learn from Heartland?
Yeah.
And
They're like,
nothing.
I don't know.
It's like, okay, so Rick Workman
Yeah.
manages 800. You don't think that Rick Workman might know a little more about managing
business,
a practice
right.
than the dentist who manages one? Look at Stephen Thorne. He's not even a dentist.
Yeah.
He manages 500 offices.
That's incredible.
So you're in a location that has what, 30 offices?
Yeah, a little less, but yeah.
That is sophisticated management. that's upper 1/10 of 1%.
Yeah, for
to
sure.
be able to have the skills to
Yeah.
run 30 offices.
Right. Yeah, I don't know.
So are you learning a lot of? So what are you taking away?
Well,
business-wise,
there's
that
no
you
real
think?
secret sauce. I think the power's in the people and your team and the people you have around you. So I think Risas has been really smart to hire well. The doctors are all, honest, stand-up guys that are energetic and passionate about their work, and I think they've hired really well. And so they'll tell you themselves that the power of Risas is the doctors. So I think you just
And
get
all
good
the
people
doctors
there.
are employees.
Yeah.
No, there's no owners.
No. Well, owner doctors, they have an equity plan for us. So,
They do.
Yeah.
So
some
are
of the
they
doctors
hiring? Are they more likely to get new grads that just graduate out of Midwestern AT still, or more likely to get the guy from Minnesota? His last kid went off to college, and he says, "I hate winters,
Right.
and I'm going to come down to Arizona."
A little bit of both.
A little bit of
both. Yeah, I think the Risas model is unique. It's tough for a new grad to come in and handle the patient load.
Right.
So I was able to do it, I think, just because my dad had the experience. He taught me everything he knew, and then with the NumbNow, and then I'm just there. I'm just learning on the fly, which was fine. But I don't think everyone can do it. But they do a little bit of both. They hire out of school, or they get guys that they just like the idea of not having to deal with as much of the headaches of private practice, and they're able to just go to work and take care of patients. So
I taught Ryan everything I know, and it took almost 30 minutes.
yeah,
It was a long head.
30 minutes. Yeah, right, dude.
Well, a lot of times they're starting. I mean, a lot of these kids are smart. They look at the macroeconomics and say, okay, so the general dentist maxed out at $215,000 a year in 2005. It's been falling 3,800.
That was the average?
Yeah, it's been falling. It was 217,000.
Okay.
And it's been falling 3,800 a year, and it's down to
Unbelievable.
175, and there's no sign of it letting up.
Yeah.
So a lot of them come out and say,
Wait a
well,
second,
if this company has a business model because it's open 9
That
to
works.
8, 6 days a week, they take all the access,
Yeah.
the insurance, it's profitable, so they're expanding. Maybe that's a safer bet than opening up your own prototype, because
Right.
there's a couple things. There's only a few major strategies, like Pew Research does the data for every state where the counties are underserved, but they don't come out of Midwestern and want to go to underserved. Like, how many times have you driven to LA?
Yeah, a lot. Yeah.
So what's the border town between Arizona and California? Blythe.
Okay, yeah, Blythe, yeah.
Blythe doesn't have a dentist.
Okay, no dentist, really?
No, and I remember when some of my friends were coming out 30 years ago, and they were like, "Oh, I want to go to North Scottsdale." I'm like, "Dude, Maricopa doesn't have a dentist."
Yeah.
They had 9,000 people and no dentist. Florence had 7,000 before it got dentist.
Interesting, yeah.
Like, to this day, the dentists in Maricopa, they're just crushing it.
Really?
And the dentists in North Scottsdale are suffering.
That's what I hear. It's
But
either...
what's the stupidest thing is, so many of my friends live here in Phoenix,
Yeah.
and the commute to North Scottsdale is the same commute to Maricopa.
Oh, right,
So guess
right.
where they
wanna
went? They
practice in
commuted
North
an hour where there's a dentist for every 500 people,
Yeah.
instead of commuting the same hour to
doesn't
where
make
there's a
any
dentist
sense.
for every 3,500
Yeah, that
people.
doesn't make any sense.
Because they don't understand demographics. And I say,
Yeah.
to understand demographics, what you should do is you should graduate from dental school. You should set up your dental office in Afghanistan, Somalia, Syria, and practice there until
Yeah.
you realize maybe demographics matter.
Yeah, maybe.
Maybe if so.
Yeah, it was interesting, the decisions
But you
people
don't
made
have
out
to
of
do your
school.
demographics, because Pew Research has done them for every state, because they're trying to get dental therapist passed.
Somebody said that the happiest dentists, these assistants who worked with multiple dentists, they said the happiest dentists they ever saw were Risas dentists, which is I felt like was kind of interesting. And I don't know the reasons.
I'm
but
the happiest
I think
dentist
part of it is a lifestyle.
I'm eating Reese's peanut butter cups.
There you
I can
go.
definitely vouch for
Reese's.
that.
But yeah, part of the lifestyle, being able to right out of school, work 3 days a week. I'm home 4 days a week. It's great. My wife loves it. And then being
So
able to.
that's definitely some weird newly shit stuff. To say that she wants to spend 4 days a week with her wife. Come back and tell me that in 20 years. No,
Right.
So you work 9 to 8 what?
Yeah,
Which
9
3
to 8.
days?
So every week it's different.
Okay.
Yeah,
so you do
schedule
3
varies.
days, then you're off 4.
Yeah.
So they're long days. What does it feel like at 8 p.m. at the end of the third day? I mean, you're. Well, I'm saying this. You're 32.
Crushed,
How
yeah.
old's your dad?
So my dad's 50, mid 50s. So.
Okay, it's the same as me. We're both 55.
Okay.
So do you think you can do that because you're 32? Could your
Yeah.
dad
Yeah.
Could your dad and me do that, or is
so the longevity part of it? Yeah, that's definitely a question mark. You know, it's backbreaking work. Dentistry in general is backbreaking work, I think. And then if you're seeing double the amount of patients, yeah, it's definitely backbreaking. But that's I think every individual's decision. If you have good ergonomics, if you know, I don't know. I really don't know. I mean, I've only been in practice a couple years. My body feels great, but I could see how it could get tough.
But you're a professional athlete, so you're probably a
more or less.
You know,
as long as I keep that core
No,
strong.
I mean, have you ever been paid for sports?
I got paid, yes.
And you're a professional athlete.
Yes, my one claim to fame, I did get paid to play
Then you're
basketball.
a professional athlete. I'm still shocked that the Arizona Cardinals have never even interviewed me.
Yeah, that one $2,000 check was great. No.
It was so when you go around the world, a lot of the names, a lot of people's names actually came from their occupation, like Smith was a blacksmith.
Yeah.
And when you go around the world, you know, if you're born in Somalia and you're a third generation goat farmer, that's the smartest businessman. I mean, when I was in Kansas, everybody that I knew that graduated from high school that went into growing wheat, corn, dairy, those farms were in the family for hundreds of years.
Yeah.
So kids following their parents' occupation is around the world. Any dental school I go into, I say, raise your hand if someone else in your family is a dentist.
Yeah.
It's a quarter to a third of the hands go up.
Yeah.
Was your dad the first dentist in your pedigree?
He was, yeah.
So you're number two?
He was kind of the trailblazer. His dad was...
And how many kids did your dad have, and how many went into dentistry? How many kids
Yeah, so 5 of us, and I'm the oldest, and I'm the only one to go into dentistry. My brother does finance. He lives in the Valley. And then my littlest brother, he's on a 2-year church mission in Thailand right now. So he's going to get back. He wants to be an engineer, though. He's the brains of the family. I think he wants to be a rocket engineer or something like that. So yeah, we'll see what he does.
So where along your journey did you decide you wanted to follow Dad? Did you think that he...
In the beginning, I was like...
Did he encourage it?
In the beginning, I was like, there's no
it?
way I want to do what my dad does. I was petrified of needles. I don't know, it was the vaccines for school when I was little or something. I'd go, and then I was already scared of my dad because he's kind of an authority figure, you know? And I don't know, children used to live in fear of their parents, right? I guess he's great. I love him. But yeah, I was a little scared of him. You know, I didn't want to disobey. And then I come into the dental chair and it's like him with a needle. It was like the scariest thing in the world, right? So I would tell him, I would be like, drill on my tooth. I do not want a needle. And I refuse needle. I was the worst patient. And so I would let him drill occlusal fillings with no needles, and I'd just take it, you know. But so growing up, I did not want to be a dentist. But it wasn't until I had a little interest. The older I got, he'd come home every day and just be like, dentistry's great, you know. 4 out of the 5 days, and 1 out of the 5 days, he'd be like, man, I don't know if you want to do this, you know. I had a tough day today. But then it wasn't until I was on my 2-year mission trip in Ecuador, and I saw these dentists come over for humanitarian purposes, you know, with the Red Cross and you know, Smiles, what's that company? Smiles something. Anyway, Operation Smiles. So they would come over there and they would do this service, but then they'd also get to see the foreign country, travel. I was on the Galapagos Islands on my mission trip. So I was in Ecuador, but then that's owned by the Ecuador. And I was out there and these mission trip people came. And I had a change of heart. I was like, you know what? If I could really I just want to be in a service-oriented job as opposed to selling a product. I wanted to be serving people, and that's when it all clicked. And
so it's kind of a faith-based decision.
Yeah, when I got home, I was like, I want to help people out. I want to use my hands.
You know what I love the most about the Mormon missionaries?
What's that?
Oh my God! So you're taking these young kids that just got out of high school, right?
Yeah.
Pre-college,
18,
right?
18, 19, right?
So that's about the most open-minded you're ever going to be. You're not going to change a 50-year-old from a Republican to a Democrat. Like my sister's, that's a nun. Do you think I could turn her into a Lutheran or a Jew or a Muslim? I mean,
there's no chance.
So they're at that juncture of the most young, impressionable, bright-eyed, bushy-tailed, still open-minded. And I've lectured in 50 countries, and we always, whenever we see them, you know, you can always spot them. You know, there's 2 guys on a bicycle with white shirts and ties. I always stop, and it's the most amazing deal because I say, okay, and I just ask them one question: how long you been here? And they'll say, I don't know, 6 months, a year, whatever. And I'll say, why do you think they're poor? Why do you think this is a third world country?
Yeah.
And this is an 18-year-old mind who's living here for a year, who came from America. And it's always the same pattern. So you read this stuff when you're studying economics about what corruption does, what poverty is systemic to. I mean, the
breakdown of the family and how that affects society.
The breakdown, all this stuff. And it's so funny. And I always thought to myself, the greatest book that needs to be written is to get there's 220 countries, get 2 of those Mormon kids at the end of their missionary, set everyone down in a room and say, why do you think, Somalia was poor?
Interesting.
Why do you think Ecuador is poor? Why do you, and just have this index, because there's Mormon missionaries in Phoenix, Arizona.
Right. No,
I mean, they have Mormon missionaries from Phoenix that were born in Phoenix, right?
Yeah, totally. Yeah.
I mean, you could
All
be
over.
born in Phoenix and your mission could be in Phoenix, or it could be in
Phoenix,
Ecuador.
Could happen.
And I want to write the book
Okay.
of, and it needs to be written. I want to interview 222 kids, because I always see them in pairs. Is it a pair thing when you're out on a mission?
Yeah, it has to be. It's a rule.
Yeah, I want to get the 220 pairs from all 220 countries, and then see how the story changes from Luxembourg all the way down to Syria.
Interesting.
So
what do you ask the ones that practice or that are here in Phoenix serving or whatever? You would ask them the same question?
It's a function.
Why are people poor?
It's a function of. At the end of the day, it's a function of lying, cheating, stealing.
Yeah.
I remember I did a missionary trip in Africa one time, and I got there. Here's 4 of his dentists flying all this stuff, and we get there, and the luggage comes down, everything comes down, but our big box of dental supplies. So out walks the military guy at the end, and there's our deal. And we go, oh, there it is. I'm thinking that's too big for the conveyor. He puts his foot on it. He said, that'll be $500. What? I go, dude, we're volunteers. We're down here. We're for an orphanage, and so what does that say to everyone coming into your country to help the poor?
Yeah.
First thing I had to do is pay a bribe.
Yeah.
And then what is the chance that you could do that at Sky Harbor Airport?
0.
And people don't realize that, they think our government's great, but it's all raising money and bribery.
Yeah.
And if you got rid of all that, decision making would be, well, what's the best decision?
Right.
Whereas right now it's like, well, where's
Who
the
has the
biggest
most
bribe?
money?
And they don't see that in America because they see it so much worse in South America or Asia or Africa.
Makes sense.
The joke I love my favorite international joke was an American businessman walks up and points to, he says, see that bridge over there? And he says, yeah. And he goes, government contract, I made 10%. I go, cool. So they go to Asia, and the guy goes, see that bridge over there? And he goes, yeah. And he says, government contract, I made 20%. The guy goes, cool. Then they go to Africa, and they say, see that bridge over there? He goes, no, I don't see a bridge. He goes, government contract, I took 100%. And so it's just a level of, you can't have third world poverty without it being systemic in the business and the family. And another thing about it that was in these poor countries in Central and South America, I remember in Panama, if you have a 27-year-old man who had a child with 6 different ladies, that's systemic poverty. Yeah. Because you got 6 ladies sharing a breadwinner. So the family unit is an asset builder or it's an asset destroyer. So when you go to really poor countries and the government's all lying, cheating, and stealing, and then men are having babies with 4 or 5 different women routinely, and then you're shocked that they're a third world country. Right. So how do you fix the government from lying, cheating, stealing, and how do you teach this man to say, no, I'm only going to be married to you? So it's tough. And it's tough when only 0.3% of mammals are what do you call it when you only have one spouse?
Monogamous.
No, only 0.3. It's not an animal.
There's like rare species of birds, right? And
because if you say there were 10 boys and 10 girls, and it doesn't matter if you were penguins or monkeys, and 10 of them went away for the day and 9 of them got eaten by a shark and 1 came back, it just doesn't make sense that one guy say, oh no, I'm only with Amy. Right. And then you have 9 females.
Right, that makes sense.
So the number one biological thing is, can we always keep everyone fertile and reproducing and having offspring? So monogamy is not natural. There's nothing natural about monogamy. It's only 0.3%. So, but I just love, I love some of the greatest conversations I ever had were these young kids. How old would you say the average one is?
So the average is probably 18, 19. Yeah. I served from 19 to 21. They lowered the age to 18 so you wouldn't have that awkward year after graduation. Yeah, and girls. Girls have been able to go for a long, long time. All right. Ever since the beginning, I'm pretty sure. But yeah, they lowered the age.
So, man, if you're ever on a European vacation, wherever you're at, you see 2 Mormon kids, say, hey.
Yeah, stop them. Say hi.
Hey, stop. I want to buy you lunch.
Pick their brains a little bit.
Shut up and listen to these young whippersnapper minds,
But
bright-eyed.
that's when my heart changed. That's when my heart changed, when I was out there and I saw these people coming over on the mission trips. I saw the level of poverty. I mean, you got people living in cane shacks. They drill a hole in their floor and their sewage is right underneath their house, like literally. I mean, you have places too that the taxi drivers don't go, the cops don't go, because it's just another level of it's like anarchy. You have people machete fighting, cutting off each other's arms, like all kinds of crazy.
You saw that in Ecuador?
Yeah. It's pretty nuts.
The most interesting thing I ever had though is I talked to this. You're an idiot when the local dentist won't take you there. Yeah. And I remember none of my homies in Alaska would drive me to Prudhoe Bay.
Okay.
Because when I was in Alaska, they don't have there's no public road to the Arctic Ocean.
Yeah.
But there's the Alaskan pipeline has a service road. But there's all these big signs, you can't drive this private property.
Okay.
But I mean at the Waffle House, and I said to the guy, I said, so what do you think happened to me and Dad driving that road? And he said, dude, I see a sheriff like once a year. He says, but you won't have enough gas to get there, so you need 5-gallon deals of gas in the back. So you're driving a car, breathing gas fumes. All the local dentists wouldn't go with me. They're like, you're out of your mind.
Right.
And about halfway through, you realize, yeah, we are out of our mind. I mean, the roads are washed out. It was insane, but it was the most fun deal. But I was in Brazil, and I told him I wanted to see a witch doctor. And
just for the experience?
It was about an hour in, and these guys said, no, man, that's dangerous. That's dangerous.
Don't do this.
No one to do it. But I found a taxi driver
to take you there.
I mean, it was so cool. I mean, I was in this hut. He had all the makeup, the bowls, the lotion. I mean, it was batshit crazy.
Wow.
But it was anthropology heaven.
Yeah. Yeah, you talk about other levels of experience. I mean, that's priceless.
And I'm street smart. So we were in, a lot of times, I've been in some big towns in Africa where, I wanted to see the garment district, and the local people at the hotel say, no, you can't leave the hotel privacy. We got this big fence. We got razor wire. It's not safe. It's not safe. It's not safe. You can't do that. And all the dentists I'm with like, that'd be a dumb idea. But then I walk across the street and I see the biggest man in the whole place. I mean, I'm just looking for someone who's just twice as tall. I'm looking for that 300-pound Charles Barkley. And I walk up to him and I said, I want to see the garment district, but they say it's not safe. Then I show him a Benjamin. I said, if I pay you a Benjamin, can you walk me to the garment district?
Sure.
Yeah, absolutely.
Yeah.
So, I mean, you just got to be smart about it. But, God, I love... so was the mission trip one of the biggest highlights of your life, going to Ecuador, away from home, leaving mom and dad, going to Ecuador?
Short of my marriage and kids, for sure.
I mean, that's a stunning...
It's like number 3. But.
Well, I mean, it's like to take a kid out of his... element and put him in a whole different element and a whole different language. 2 years.
Yeah, it was brutal. But one of the biggest things was I was at Risas in my office, and I just felt so grateful and so blessed to be in an awesome opportunity right out of school. And I just had this overwhelming feeling come over me, and I believe it was inspired, divine. And basically just said, you are here and I'm taking care of you because you served a good mission. Because I took care of people, God was taking care of me and has me in a situation where I'm able to, continue helping people. And it was pretty cool.
That is so
pretty
cool.
Overwhelming. So I'm happy to be a dentist. It's by far and away, one of the best decisions I've ever made. Short of going on my mission trip, getting married, having kids, a great decision to be a dentist. And
you don't know how the kids are going to turn out yet. How old are they?
They're really young.
So see, everybody. Let me tell you about kids.
1 and 0. So
when your kids, before they get their car keys, you'll think you're such a good father that you should write a book on how to raise kids.
Right.
But one by one, you give them keys to a car, and they'll get more trouble and mayhem. So come back and talk to me when they're 16 to 21.
Gotcha.
And
we'll see. That's a scary thought. We'll see.
How old are they now?
So 0 and 1. So we have a 3-month-old, and then we have one that's almost 2.
So that's good, because the 2-year-old doesn't have any jealousy, because at that age, they don't really realize that Tuesday I was the only child, and Wednesday there's some baby.
He's clueless. He's clueless.
Yeah.
Baby.
My boys were all 18 months apart, and I love the fact that they never knew that yesterday they were the only child. Today there's 2.
They didn't have a long time to get all spoiled. And stuff.
But I also like that it was so close, because my friends that had one child, it takes twice as much effort to raise an only child, because they want you to be on the swing set. They want you. They're looking for a friend.
That makes sense.
When my 4 boys were 2, 4, 6, the whole time, I always thought, I could probably leave, go to Makayo's restaurant, have dinner, go see a movie, come back 3 hours later, they probably wouldn't even know I left.
They wouldn't even know.
Because they were just a tornado running around the house and the backyard and
That's funny you say tornado. My brother has 2 kids, and I asked him how it was. I was like, how's it going? And this was right around when the hurricanes were hitting. And all he did was send me a picture of Hurricane Irma. And he's like, this is how it is going from 1 to 2. Which is pretty true. I mean, kids, I mean, it eats up so much time. I don't have time for news anymore. I don't have time for sports. Like, I focus on my career, you know, and dental town, getting better, learning the craft, and then my kids, and that's pretty much it.
Well, that's awesome.
What else do you have time for?
And don't be that Oscar the Grouch. Don't be.
There's no reason to be.
I mean, if you're
great.
watching news and it's making you feel horrible, and you're scaring your grandchildren or your children, stop it.
Yeah.
Watch something that makes them not see you as Oscar the Grouch and sees you as, I don't know, what would be a good one?
But if you throw up a YouTube video of an implant procedure or something, they might get a little sketched out.
You know what? My granddaughter, she's already telling me she wants to be a dentist because we're always doing that. You know Jared Pope?
I don't know.
Jared Pope's a buddy of mine in Maricopa.
Okay.
He learned how to place implants just by coming home every night after work.
Okay.
Has Apple TV.
Yeah.
Would YouTube dental implant surgery, throw it up on his screen.
Yeah.
And my God, my grandchildren are glued to that. They're like,
Wow.
what are they doing?
They're just fascinated by it.
Well, it is. Well, hell, it's fascinating.
Yeah, it really is.
I mean, how the hell could that not be fascinating to a 5-year-old? But hey, thank you so much.
Thanks, Howard.
For making the time to come over and share your journey with my homies. They're all commuting
Appreciate
to work, and they love to. They know their story,
Yeah.
and it's just really cool to hear other people's stories.
I love it.
Thank you for
I love
sharing
it.
your journey.
I love it. Thanks, Howard.
And give
Appreciate
those
everything.
2 babies a kiss from Uncle Howie.
I will.